For centuries, hospitals have been the pillar of support for the healthcare industry. As the major healthcare facility in its region, hospitals are armed with expensive and cutting-edge medical equipment to provide patients with treatments for urgent health problems ranging from injuries to sudden illness. Hospitals complement and amplify the effectiveness of many other parts of the healthcare system, providing continuous availability of services for acute and complex conditions. Hospitals are also an essential part of healthcare system development. In other words, hospitals serve humanity and play a vital role in social welfare of any society. However, under the immense pressure from a global pandemic, healthcare system's shortcomings and hospital sector deficiencies are driving a new vision for hospitals in many parts of the world. Generally, there are two types of hospitals: private hospitals and government hospitals. The private one is run by an individual or group of physicians or organizations. On the other hand, the government runs the government hospital. In the middle, we have semi-government hospital that a private organization and government run together. Furthermore, there are general hospitals that deal with different kinds of healthcare but with a limited capacity. General hospitals treat patients from any type of disease belonging to any sex or age. Alternatively, there are specialized hospitals that limit their services to a particular health condition like oncology, maternity, and more. The main aim of hospitals is to offer maximum health services and ensure care and cure. Many of these hospitals also conduct research works for people. The essential services which are available in a hospital include emergency and casualty services, OPT services, IPT services, and operation theater.
Any hospital, even the most rudimentary or backward of them, can provide more treatment options for a patient than in-home healthcare would. Hospitals are equipped with medical equipment that aids in the diagnosis and treatment of the more serious patients. Take, for instance, a case of an accident. Taking an injured individual to a doctor's private chamber or calling the doctor home will not provide the kind of adequate and timely attention that a hospital will guarantee. Be it emergency operations, critical care, or life support system, these are all facilities only a hospital will be able to provide. When you go visit a hospital, you will find a host of doctors, nurses, and interns milling busily about. At any given point of time, more than one doctor will be attending to a patient. This routine, when properly coordinated, provides the patient with maximum care one can receive in their condition. Doctors are in consultation with each other regarding a case, which makes it possible for the patient to receive an unambiguous diagnosis and treatment. The availability of more than one doctor and nurse also means that the patient can take as many opinions as they want. Most importantly, no patient will ever go unattended at any given point of time in an adequately staffed hospital. Hospitals provide a specialized treatment that certain illnesses require. A person with a contagious illness or carrying germs categorized as biohazards cannot possibly be treated at home. Again, certain illnesses require constant medical attention that only a hospital infrastructure can provide. Sometimes, people suffering from psychological illnesses or cases of trauma or abuse can only be safely housed in a hospital. Specialized hospitals for different diseases ensure that each section of the population receives the proper and particular care that they need.
Across the whole Malaysia, the Ministry of Health has identified 35 hospitals to serve as COVID-19 admitting hospitals and the remaining hospitals, including the health centers, as screening centers. All these hospitals have been procuring essential material, including testing kits, personal protection equipment, medicine, and ventilators. Around May of 2021, Sungai Buloh Hospital is forced to store COVID-19 bodies in special containers. The Forensic Department of Sungai Buloh Hospital in Selangor is providing a special container as an additional place to keep the bodies of dead COVID-19 patients. A few days later, government hospitals are running out of beds at designated COVID-19 intensive care unit nationwide. And the dramatic increase in COVID-19 cases has put tremendous pressure on the national healthcare system.
Medical treatment is the management and care of a patient to combat disease or disorder. Medical treatment includes of using prescription medications or use of a non-prescription drug at prescription strength and using wound closing devices such as surgical glue, sutures and staples. Moreover, it also includes using any devices with rigid stays or other system designed to immobilize parts of the body. Other than that, medical treatments includes administration of oxygen to treat injury or illness. There are varieties of medical treatments are used to cure illness. The types of medical treatments are chemotherapy or other drug therapies, radiation therapy, immunotherapy, vaccine therapy, blood transfusion, clinical trials. As in conclusion, hospitals have traditionally been associated with illness instead of wellness. We visit a hospital when we are sick, being habituated to quick fixes to our problems. However, hospitals can play a much more important role by spreading importance of lifestyle changes by providing consultation services even before the patient becomes ill. This way, we shall become a much more healthier population and spend a lot less on healthcare than we do at present.